Hi, Dr. Madatula. How are you doing?
I am great.
Pleasure to have you back. We're going to talk today a little bit about infections that can happen during replacement surgery. So, how often do infections occur during a joint replacement surgery?
Yeah, so it's a really interesting question. Actually, infections themselves are pretty common if you look at for the reasons why joint replacements fail, but overall, they're not that common. And the bigger thing that drives infections is actually the health of the patient. So, what I want you to imagine is that a person of normal health getting a joint replacement who maybe just has a little bit of high blood pressure really has a very low risk of getting an infection because we clean our hands, the implants, the room, the patient, everything is as clean as possibly can be. And there's a very small probability that some bacteria could be left from that cleaning process, and that would be the only possible way that a bacteria could infect the patient. The but as you get less healthy, so say you have an organ transplant, or say you have diabetes or obesity or other things that are known to compromise the immune system, then even if we get rid of those bacteria, that one little bacteria left has a higher likelihood of surviving, and that can change the likelihood of getting an infection. So I would say it depends on medical comorbidities, and it can range from almost non-existent all the way to really, really relevant, hovering around maybe 20% of the patients that we operate on.
Oh, wow. Um, when a joint gets infected, what's actually going on in the joint when that happens?
Yeah, so what happens is a couple of things. First thing that happens is the bacteria need to grow like they would anywhere. So, say you got a pneumonia, the bacteria would grow inside of your lung. And then it's very interesting because the implant is there. The bacteria can actually set up little cities called biofilm. And that biofilm is actually a living organism where the bacteria communicate with each other, and they can actually live on the metal. They can actually live on the metal such that even if I give you antibiotics, we can't kill the bacteria. And that's a very interesting phenomenon that occurs. It probably occurs in other places in the body too, but it's very much relevant with respect to implant infections. So, what's happening inside the joint is the bacteria is setting up a place to live on the joint replacement itself.
What are the signs that this has happened? How could I tell if I just got a surgery that I'm experiencing an infection?
Yeah, that so the easiest signs are you'd have fever, your wound would be red, and your wound might drain after surgery. And you may have pain that's difficult to control, and pain maybe even at rest. The problem with this is that a lot of patients after surgery who don't have an infection have those things. You could have pain at rest, some swelling, some redness. And so ultimately, it takes a lot of experience to diagnose an infection. But maybe even more important is what happens if you get an infection and it's not right after surgery. People can get an infection even after surgery, either from circulating bacteria in their blood or from that biofilm that got set up on their implant that didn't show itself as an infection, but for years and years and years later. Um, those patients may feel nothing. They could feel almost no symptoms, or maybe just a little bit of vague, achy pain. Or they could have the things we talked about: redness, draining wound, fevers, chills, and even get sick to the point where they may need to go to the hospital. So, infection can present in a very, very broad way, and it can be sometimes hard to detect. But if you're having pain that's not controlled, or there's something going on with the wound, for sure you need to see someone. We need to have a talk about infection.
If I think I have an infection, what should I do?
Hmm. Very interesting. So I would say, if first thing you should do is seek help. You should see an expert in joint replacement surgery who can do some tests to see if you have an infection or not. The most common symptom is pain, and pain can be caused from lots of different things. If the infection is acute, meaning it's just started right after surgery, we can talk about doing some surgeries to potentially salvage the implant, meaning we could clean out the joint, change the modular parts, and see if we can retain the implant that's fixed in the bone. But if it's been going on for a long time and those little biofilm cities have set up, we need to talk about removing the implant. So the best thing a patient can do is be vigilant and be aware of the symptoms of an infection so that they can see their provider and get the best treatment possible.
So, what are those treatments that you've referenced?
Yeah, so there are a few. One of them is not antibiotics, again, because of those cities. So almost all the treatments for a joint infection are going to be without antibiotics and are going to require surgery. So if it's acute, meaning it just happened right after surgery, we might talk about a second surgery to open up the joint replacement, clean off any of the bacteria that are trying to form those cities, change the implant, and put you on antibiotics. That's called irrigation and debridement, cleaning, and liner exchange, change of the modular parts. So after that, we'd start talking about other things. Other things might be removing the implant. That could be something called a resection. So we actually take the implant all the way out, which could mean losing bone, could mean losing a ligament. It could mean lots of things because we have to do additional damage to remove the implant. And then putting in an antibiotic spacer, or even doing something called a one-stage exchange, which means putting in a whole new joint replacement right after we cut out that infection. The short of the story is, if you're on antibiotics, it means that we don't think the bacteria are on the implant itself. But if it's on the implant right now, we don't have a great answer for removing it without some sort of surgery.
Is there anything the patient can do outside of a treatment from a doctor that would help?
Unfortunately, if there's really an infection on the implant, chances are no. But the best thing patients can do is be as healthy as possible and to optimize themselves before surgery, meaning get your diabetes under control as best as possible, get our weight down as best as we can to, have our medicines optimized. I mean, we really can't stop from getting a medical problem per se, but if we have one, we could manage it as best as possible to mitigate the risk at the time of surgery. But for sure, getting an infection is a catastrophic side effect of surgery that sometimes happens in some people. It's a bad complication. The good part is it can be managed in the vast majority of people, around 90% of the time. But if it happens, the knee or hip is really never going to be the same. So the best we can do is to avoid it and to be as diligent as possible as looking for it so that we can get it intervene earlier.
Got it. Well, thank you so much for your time today. I really appreciate it.
No problem. Thanks so much.